What if you could have the practice of your dreams? What's holding you back? Imagine a life where you have everything you ever wanted. Welcome to Accelerate My Practice. So glad you could join us here today. Today we're here in Aspen, Colorado shooting the show for you, which is going to be a lot of fun. We're here because we're here with a big study club that is listening to Jeff Bruscia, a restorative clinician who does teaching all over the country and all over the world, talk about restorative dentistry. We tried to talk him into doing an interview with us, but he forgot his suit and his razor was dead, and so he said he couldn't do it. But maybe another time we'll do it. So we've been on this theme lately of talking about how various conversations take place in the dental office and how you should handle those and role-playing those various conversations. And so we want to continue that here today in a very casual setting where it's gorgeous out. We'll talk about hygiene today. We'll see if we have time to get into any periodontal treatment depending on how the time flows and where we end up. But that's going to be kind of the scope for today. Any thoughts on the hygiene topic?
I think this is going to be a good segment for us to work on, role play a little bit, talk about how you guys can show the importance of hygiene to the patients, and maybe give you guys some new ideas.
Awesome. So, what are some of the challenges we experience in hygiene? And I want to discuss through those challenges and the mindset of that person first, and then we'll get into some of the role play. So one of the challenges we run into all the time is how do we keep the patients scheduled? How do we keep them in the schedule? Because there's a lot of practices we go into, and when we look at how many patients are pre-appointed for their next hygiene appointment, in many cases it's only like 50%. And obviously we'd love to see a number in the 80% range, or in a perfect world we'd love to see 100.
Part of what you're doing is you're helping your patients stay healthy. So if your patients have a healthy mindset, they are big on being healthy, great way to start with that is through the cleanings.
Why does it appear to the consumer not to be as important? Because if you read ADA stats, roughly half of Americans haven't seen a dentist in the last 2 years. So we'll go get a colonoscopy, but yet we'll skip our dental appointment. And yet oral cancer is one of the fastest growing cancers in the world today. It's mind-blowing to me.
Absolutely, I agree. And it's so simple that it's quick and easy for them to just get that healthy mouth checkup. Right? It's so quick and easy for them to have that beautiful smile and that confidence by staying healthy. And again, it seems like that. I think what's coming to me is you can see it, you can see the mouth, and if it looks fine on the outside, then it should be fine with everything in between the teeth and how you're keeping up with the health. But I think we're so focused on the internal pieces that we can't see that's why people stick to that. However, what's in your face and what's able to be seen is just as important as well.
Totally agree. You know, one thing I find really entertaining to me is you'll hear some of these patients, they think it's normal for their gums to bleed when they brush or when they floss. And obviously, any of us in the business, we know that that's not the case. I love to use the example of, hey, if your elbow started bleeding just randomly right now, would you be concerned? And of course the answer is, oh, my Lord, yeah, I'd be running to the emergency room for stitches.
Absolutely.
But yet your mouth can hemorrhage blood when you brush or floss, and hey, it's no big deal. That's normal. So some of this is an expectations issue or a definitions issue, and we need to change those definitions and expectations. We need to educate people that bleeding in your mouth is not at all normal. In fact, it's extremely abnormal and unhealthy. And I think if we start setting new definitions and having new conversations where people understand that, it'll greatly improve some of this.
The great thing that you can do to help get started is put together a list of maybe 5 questions that you go through and asking your patients so you can get a better idea as far as what they're doing whenever they're not sitting in your chair. And then you have a better way of analyzing or going through the list of questions to see, how you can inspire this person to take action.
Action is the key for sure.
Action is
So
key.
what I want to do next week is I want to continue this conversation. I want to get into periodontal treatment though. How do we get patients to accept periodontal treatment? And of course, where we're at right now will naturally segue into that. But I don't want to take up any more time today because it looks like we're about out of time.
Yep.
And the sun is starting to beat down on me. Even though I'm standing in the snow, my backside is getting really, really warm. So with that, I think we're going to sign off. I appreciate you guys joining us here in beautiful Aspen, Colorado today. And if you have questions, if you want to see other topics, please get those to us. Otherwise, we look forward to seeing you next week, 8 a.m. Mountain Time and 10 o'clock on the East Coast. Until then, have a wonderful time.
Have an amazing week.
Bye-bye. What if you could have the practice of your dreams? What's holding you back? Imagine a life where you have everything you ever wanted.